Good evening, Aquila.
Good evening. Good evening, Madam Eunice.
Aquila.
Yes, yes. Good evening.
You're good. You're good.
Yes, I'm good.
Dr. Christine, good evening.
Just unmute everyone at the moment. We will mute at the right time. Let us just have people discuss what they learned yesterday before we start. Aquila, unmute everyone.
Kuna kuomba.
Tutaomba. Saizi ni watu 33. Wacha tutaomba tu with time. Let us give them a few minutes, like 2-3 minutes, then we can pray because people are entering the room. Aquila, you've put the meeting in focus mode. Aquila,
Let me.
please change. Yeah. Yesterday we learned a lot. I can see we have 41 people in the room already. You've been allowed to unmute yourself. We can be engaging as we wait for the others. Let me hear what you learned yesterday. What did you learn yesterday? Georgia Bida, unmute yourself. Or we start with Ngige. Ngige, please unmute yourself. Yeah, what did you learn yesterday? Ngige, what did you learn yesterday? Okay, Beatrice Njoki. Beatrice Njoki, what did you learn yesterday? Who wants to tell us what they learned yesterday?
Yes, Madam. Madam.
Lawrence, yes, thank you, Ugando.
There are many things we learned yesterday for those 3 hours. But I want to talk one part, the rest can also chip in.
Yeah.
The elements of school health.
The elements of school health. Can you remember them? How many were they? How many were they?
There were 4.
4?
Yeah,
Sure.
maybe one is, let me just name. One is water, sanitation and hygiene. And the other one is nutrition. The third, disease prevention and control. And the 4th is immunization. Yes.
Okay, thank you. Let us appreciate Lawrence using the reactions. Let us just appreciate Lawrence using the reactions. Wow. Lillian Wandira.
Wandivia, hi.
Wandivia, thank you for helping me to pronounce your name. Hi, Lillian, how are you?
I am fine.
Yeah, please tell us what you learned yesterday.
I think when we were talking about stress, I I think it was an eye-opener identifying when these learners are stressed, because I think that is something that is really affecting most schools.
Mm-hmm.
And as teachers, sometimes we tend to sit on a high horse and we don't want to bring ourselves to the level of students. We want to believe maybe they're just acting up, and we don't want to go deeper to know maybe what could be affecting them. For me, that was an eye-opener, how to identify these learners who are stressed and how can I help them?
Wow.
And how can I manage it? Because I'm an ECD teacher, but you realize you get even as young as 4-year-olds, but you can just notice with their behavior and everything. Then when you dig deep, then you come to find out they are undergoing some kind of stress.
Okay.
So for me, that was an eye-opener.
Wow, thank you very much.
Most
Yeah,
welcome.
who else has wants to share what they learned? Who else feels like they want to share what they learned yesterday? Yes, Josephat Nyanga 10. Nyanga 10. Ebu, pronounce your name?
Yes, you have pronounced it correctly the second time. Nyanga 10.
Okay, what did you learn yesterday?
Yes, a lot of things, but I can mention about the dimensions of holistic development. Whereby we had, I think, 5 dimensions: physical development, spiritual, emotional, mental, and social.
Two answers there, 5 dimensions, another one 4 dimensions. How many were they now? How many were they?
I guess I got it right, 5.
Okay, yeah, we are all learning. Thank you, Mary Ngugi. Unmute yourself. Yes, Mary, unmute yourself.
Okay.
Let us first appreciate him. Thank you very much. Let us appreciate him for giving us his insights for yesterday. Okay, Mary. Thank you very much, everyone. Yeah, I can see thumbs up and claps.
Okay.
Now, Mary, tell us, what did you learn yesterday?
Yesterday, we learned about why schools exist.
Wow. Okay, go ahead.
We have schools so that we can acquire knowledge and skills. Also for to enlighten the society. To the other thing is for human resource development. We also go there to socialize with other people. We also acquire attitudes.
We acquire attitudes.
Yeah, good, positive attitudes.
Good, thank you very much. Let us appreciate Mary, all of us. The last one now, Esther Maina, so that we have gender balance. Let us appreciate Mary Ngugi first before Esther speaks. Let's go to the reactions. Thank you very much, Nancy. Yeah, Esther, go ahead.
Hello.
Hello, Esther.
So I think yesterday we learned about what do you understand by holistic development of a learner. In that one, I learned that as a teacher, I should understand the learner physically, emotionally, spiritually, intellectually, socially.
Wow.
So that we can say that I have understood the holistic development of that learner.
Wow.
Also, I learned about the pillars of comprehension and physical environment, teaching and learning, health, school policy, partnership, and services. So that is what I learned and I appreciate.
Wow.
Thank you.
Thank you very much, Esther. Let us appreciate Esther for her feedback and insights. Now, this is just to help you get to know how to do your reflections. You know, when you remember what you did yesterday, you can easily now write down your reflections or what you've just finished. As soon as you're done with the session, you write down your reflections, because in your reflections, we are going to see your insights. What did you take home? What did you really learn? And what do you think you need to learn more to be able to understand the concept? Now we are 93 in the room. I think now we are ready to start. Madam Eunice.
Yeah, Dr. Christine, thank you. Yeah, thank you, Dr. Christine. I believe we are quorum 97. This is good number. Participants, good evening. I wish to welcome you to our day 2 session, and to begin for this program, may I invite one of us to do our opening prayer. Let us have a volunteer raising up your hand so that who is willing to do our opening prayer? Nancy Njeri.
Thank you. Okay, we are going to pray. In the name of the Father, and of the Son, and of the Holy Spirit. Amen. Our dear loving Father, we thank you for being with us since morning until this time. Thank you for all the experiences of the day. Thank you that now you have enabled us to meet again, to continue with our class. We pray that, Lord, you may grant us your Holy Spirit to animate us. We pray for all those who are animating us, that, Lord, your Spirit may continue to guide them and to strengthen them. May you also help us, our students, that we may be in a position to understand, in a position to put into practice what we are going to learn. We entrust this evening, we entrust our struggles, we entrust all what is going to go through in our meeting, that everything may be for the greater glory of your kingdom. We ask this through Christ our Lord. Amen. In the name of the Father, and of the Son, and of the Holy Spirit. Amen.
Thank you, Madam Nancy Njeri, for opening for us with a word of prayer this evening. I wish to welcome all of us on board, and I'm glad that we had a session where we were able to have a recap of what we were able to learn yesterday in view to comprehensive school health and safety. And likewise, we concluded by a very touching session on emotional health and stress. Tonight, we'll be having 2 facilitators. One is on board, the other one is just about to get in. That is Dr. Christine Owinyi and my brother, Mr. Simon Ngatia. And the 2 of them will handle a topic on health literacy and determinants of health. Daktari, karibu on board. We have 113 participants, and time now, it's 5:45. Kindly, karibu.
Yeah, thank you very much, Madam Eunice. Today we are going to talk about health literacy, the determinants of health, being our day 2 of session 2 of the introductory module. In the previous unit, that is, yesterday we discussed the concept of comprehensive school health and learned that health is paramount for any effective learning to be realized. Now, in this unit, rather today, we will discuss the importance of health literacy and social determinants of health. It is important for us to take note that learning institutions are tasked with the main responsibility of delivering quality education to the learners at all school levels. This means that it is important to look at the place of health literacy and matters to do with school health that are very, very important. And so we are going to see why it is important for us to talk about health literacy. Why is it important for us to talk about determinants of health? In today's lesson, this is what we are going to look at. And I believe at the end of it all, we'll all have insights that we are going to take home. Remember, literacy is a right, not a privilege. So everybody has got a right to know. Everybody has got a right to be informed about matters to do with health and the determinants of health. Now, what are our learning outcomes? That at the end of the day, we want us to be able to first demonstrate understanding of the concept of health literacy and determinants of health, that we really understand what we are talking about. When we talk about health, what are we talking about? When we talk about literacy, what is it? What is this thing called literacy? And then together, health literacy, what is it? And then we come down to talk about determinants of health. So we are going to unveil the various determinants of health, and in the process, it will be very easy for us to be able to share with any other person what health literacy is all about and what the determinants of health are. We also want us to utilize the knowledge of determinants of health to promote health in the school community. In essence, the reason as to why we are doing all this is to ensure that our schools are healthy. Our schools are healthy, and all the stakeholders in our particular learning institutions have understood matters health, education matters, determinants of health, and how they are supposed to take care of themselves. And finally, it is not just enough to know, it is not just enough to understand or to go out and make use of this information. It is also important for us to appreciate the role of health literacy in schools. Because if we really appreciate the role of health literacy in schools, then it will be very easy for us to take it seriously and promote health education in our learning institutions. Now, as it is, we have to start from the point of knowing. Remember, we are simply facilitating learning. In the process, we are learning as you're learning. So we have to start with what we know. And then we talk about what we want to know. It is from what we want to know that we will now start picking insights in the process of our learning as we continue. Now, in preparation for undertaking this study on health literacy and social determinants of health, I want us to go to our breakout rooms and discuss freely on the skills, knowledge, and attitudes that we already know about health literacy and determinants of health. Then that is for the first 5 minutes. For the next 5 minutes, you discuss what we want to know, what you want to know, what kind of skills, what kind of knowledge, what attitudes would you like to know or would you like to acquire about health literacy and determinants of health. Remember, here we have two things. There is health literacy, there is determinants of health. So when you are discussing, you can touch on either or you can touch on both. So we have 10 minutes to get to our breakout rooms. Let us make good use of these 10 minutes so that we learn in the process. Besides what you know, what you want to know, write somewhere what you have learned from what you are discussing in your groups. So please, at the moment to get into a breakout room, identify a leader who can be your chair, and then identify a secretary who can be noting down your points. Then when we come back, I'll just pick any group to share their presentation. I hope that is clear. And even before we get to the breakout rooms, those of us who have not renamed our gadgets, please click on the name of your gadget and rename, give it your name so that your group members are relating with a person and not a gadget. Thank you very much. Is that clear to everyone? Is that clear to everyone, what we are going to do? Please don't take a lot of time. Don't waste a lot of time settling down because you only have 5 minutes. 5 minutes for no, 5 minutes for want to know. Then we come back to the plenary. Mr. Aquila, please give us 10 breakout rooms, I think is okay. 10 breakout rooms for 10 minutes.
Okay.
And those who will remain at the plenary, please discuss. But I hope everybody will get into a room. Yeah, the rooms are ready. Please go to your room. So we have like 16 people in every room. Yeah. Yeah, please go to your room. Please go to your room. Thank you very much, Mr. Aquila, for the good work. Everybody get to your room, and once you get to your room, be free and discuss. So we only have 2 people unassigned. The rest of you have been assigned rooms. Please go to your room. Those who remain at the plenary, we have 8 minutes remaining. So those at the plenary, can we discuss this? Yeah, please discuss this. Let me see who is at the plenary. Mary Kibuchi. Tasmin, you're here. Tasmin, how are you?
I'm fine, thank you. How are you, Dr. Christine?
I'm fine, thank you. Can you lead this group?
Okay, fine. How many are we? I can't see.
You're 17. You're 17.
17, okay. Good afternoon, dear peers. Who would like to start letting us know what is health literacy? What do we mean by health literacy? Hello? Can everyone hear me?
Everybody,
hello?
Please unmute your mics so that you cooperate.
Literacy
Jasmine,
is about, yes?
You have Doreen Watwa, you have Neon Ray. You can call them. You can get their names at the participants, whatever.
Okay, fine, thank you. So, Madam Noreen, can you please give us an idea about Doreen, right?
Yes,
Doreen. Would you like to give us an input of what is health literacy in your context? We are talking about health, and literacy relates to the knowledge about the health. Hello? Neon, would you like to try? Neon? What about Cyrus?
Tasmin, unmute yourself. Aquila, please assist Tasmin to ensure that the room is organized.
Okay.
So I stop sharing my screen so that you can see each other.
Can I start now, Dr. Christine?
Yeah, please continue. I want to go to another room to see what they are doing there.
Okay, fine. So does anyone would like to try what we mean by health literacy? We want to find out about the knowledge of literacy of health. In my context, it has to be very holistic. What do we mean by saying holistic? Would anyone like to try to give an input? Hello? Hello?
Yes, hello.
Yes, who is this speaking? Would you like to give us a feedback?
Maybe you can pardon the question. I've just joined the meeting now.
Okay, we want to know what is health literacy.
Oh, health literacy. My trial is that this is about the healthy practice in terms of holistically, spiritually, emotionally, and
physical and psychological.
Yeah.
Yes. Are they very important to be? Is it important to have all the aspects at par, or is it that one has to dominate the other? Hello, would anyone else would like to try? Hello.
I can say.
Yes.
Health literacy is a knowledge that one have about the wholesome well-being of a person.
Yes, very good. What was our second question? Because I know the time is running. We were supposed to, yes. What would we like to learn about health literacy?
The aspect of the healthy literacy.
Yes.
That is one. The other one, how do we achieve the healthy literacy?
Yes. For the and now in what context? For the children, how do we achieve health literacy for the children?
As a teacher,
yes,
I
even
think
for the. Sorry.
As a teacher.
Yes.
Oh, sorry.
Yes, you were saying as a teacher. Hello. Hello. You were saying as a teacher. Hello.
Hello.
Okay,
I was saying.
Yes.
How, as a teacher, you can ensure that your children, the children that you are teaching, have a good, healthy literacy.
Yes, and also the teacher should have a good well-being, because if the teacher is not having a good well-being, then the teacher cannot do the good job for the students, because the teacher is in charge of all she's responsible, or he or she's responsible for all the children in his or her class.
Yes, I agree.
And also I would add that there's even aspect of health literacy in the school as a whole institution, because if we have support staff not well, then we will not have the basic things done in school. We will not have the school cleaned up. We won't have the toilets cleaned up, which will be secondary issue where we'll have health issues. And if you think of COVID also, you know, everyone has to be at par with the health and be healthy and clean. Hygiene is a very important aspect for health, especially when there are many people in the institution.
Yeah.
Can you add more to this, what we are discussing? And do you think there's something else you would like to know? Because we are supposed to even find out what we would like to know.
I think in our group, we have more than 40 participants.
Yeah, but nobody's participating in time, is just running. So let us just get on. Just be quiet.
They should raise their hand using the technology way.
No, they're just keeping quiet. And even Miss Christine waited and Dr. Christine went away to another room. So let us just finish. And then we move on, because I think time is running now. And now we were supposed to discuss two things. One was health literacy. Another one was what we don't know about it. What would you like to know more about it?
Give me what to eat, then I will keep it. Is there anything?
Now, also a very important aspect is food. If the child has been fed from home and the child comes to school, we have these problems in some local schools where when the children, for example, in the outskirts of urban areas, where the children have to walk long distances and their parents haven't been able to give them enough food because they have financial problems. And so the child will not even be able to focus in the class.
And therefore, we should know what we should do as a teacher to cater for that issue.
Yes, and then when the child is misbehaving or when the child is underperforming, the child should not be punished for it, but the teacher should try to understand where the child is coming from, what is the problem the child is dealing with. And also, that's why I know that with the NGOs.
Sorry for your interruption. I think the
Yes.
last point that you have stated should be on healthy practice,
Yes.
rather than what we want to know.
Yes, yes. Very true. That's very true. And then we have, are we really in the right place? We're in the plenary. You know, we're in the plenary. Yeah, okay. And also, we have, the good part is that we have had these practices going on in schools where the NGOs have collaborated with the government institutions, and they provide good food to the children with fortified elements, vitamins and minerals.
The other one
Hello?
is integrating.
Yes, sorry?
Integrating good grooming lessons
Yes.
in all the subjects.
Yes. And what else? Anybody else, please? We are 40 of us. It's only 3 people who have participated.
Emphasizing on the cleanliness of the environment of the school.
Yes, very important, paramount. Paramount. And also educating the children about health issues, and educating the children about how important health is for their own well-being. Hello? Hello?
Yes, we can hear you.
Yes. Who else would like to contribute?
Guidance and counseling on the
Yes, yes. Yeah, true. Guidance and counseling is very important issue in the school, because children come from different backgrounds. Children have their different problems. And by the way, guidance, counseling is very healthy for mental well-being. There's nothing wrong to have counseling done. It's, you know, I'm a Muslim. In the Quran Sharif, Allah has said that counseling regularly is very, very healthy for us. So even I think regular meetings with the parents are very important to guide them, help them, because there are problems with health literacy, even with the parents understanding because of the different cultural backgrounds that they come from, the circumstances they have to deal with. So also it's very important that the school has time to organize meetings with the parents on regular basis, because a lot has to come from home at the same time. The school can only do so much. Okay, now who else would like to say something, please? I've been speaking a lot.
I think the only challenge that we have in this group is that we were not able to separate the two issues. First of all, what we want to know, and then the others. We were not able to separate the issues well.
Can we do it now? Can we do it now?
I think we have time. You can restart again afresh, so that you put them down, so that when we go to present them, you know what we know and then what we want to know. So we should start with.
Why don't you present? Because I've been leading the group. Why don't you present for us, please?
I think my network is unstable.
And in my case, you are still better. In my case, both my gadgets are going down with battery. I can get disconnected anytime. Hello? 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 Was I speaking to Timon?
I can see Wiki Bobare has up.
Yes. Timon, was I speaking? Oh, 168 of
Okay, now people have come back to the plenary.
Okay.
Yeah, thank you very much, Jasmine, for leading the people that had remained behind. I think we are good to go. Yeah. Good. Now we are back here. We are back here. Let's get to see what went on during the breakout room discussions. I would like to start with room 2. Room 2, that was Lillian. Was it Lillian Wandithia and team? Room 2. Unmute yourself. Raise up your hand. Room 2.
My hand is up.
Okay, yeah, continue.
Hello, my name is Leah.
Yeah, Leah, continue.
Okay, what we know, these are the points we came up with. That's what we know. The health literacy is being aware of health issues that may crop up in institutions and how to handle such issues. Number 2, the way an individual can understand, the way an individual can find out, understand, and then handle health situations in an institution. What we know, this is an ability, the health literacy and determinants. This is the ability to handle health issues. And the last one says, the ability to understand health information and how to make decisions or take actions related to the information that somebody has.
Okay.
Then what we want to know is how to handle, how to handle different health issues in an institution. Number 2, how to handle stigma in a learning institution. Number 3, we would like to know other bodies that we can partner with in handling health issues in an institution. For example, Red Cross, St. John's Ambulance, and Ministry of Health. Number 4, how to equip institutions with skills and equipment to handle the different health issues. And then lastly, legal frameworks pertaining to health issues in institutions. We didn't get to the third part because of time.
Yeah, that was okay. That was adequate.
Yeah.
We have 2 parts that we were supposed to discuss. Let us all appreciate group 2. Let's go to the reactions. Wow, Alvin, that was your group. Well done, well done, well done. Thank you very much.
Thank you.
Good. Now let's hear from group 4. Let's hear from group 4. Group 4. Who was the secretary? Group 4, we had Lucy, Gichana, and Tim. Wycliffe, Maisiba, I think you were in group 4.
Yes, Madam, we had Celestine. She was our secretary. If she can contribute, yes.
Okay, Celestine, it is your turn.
Thank you. I had some network challenge, but I thank God I'm now back. Are you getting me?
Yes, continue.
Okay. So we talked about knowledge and skills and attitude in health literacy. And we said that it is the ability to prevent diseases and to manage them within the school environment. We talked about determinants of health literacy. Then we said that we should have appropriate infrastructure within the learning environment. We should have a working guidance and counseling department. We should, that particular school where there is health literacy should have good interpersonal skills. There should be availability of resources for good delivery of content. There should be the ability to have sober mind in the working place. Then we also would wish to know the following: how to apply health literacy in teaching and learning, importance of health literacy in learning. Thank you very much. Because of network, I may have missed 1 or 2 that were said after the 5 minutes were added. So if there is any member with a contribution can add.
Okay, any member with something that maybe Celestine left out when she dropped from the meeting? Maisiba, has she captured everything because you are the chair?
Yes, Daktari.
Yes, has she captured everything?
Yes, Daktari.
Wow, thank you very much. Now let us appreciate group 4 for work well done. Thank you very much, Alvin. Thank you, Josephat, Mose. Let us appreciate Wycliffe. Thank you for clapping for them. Ngugi, thank you. The rest of us, where are you not appreciating your colleagues? Hey, let me see everybody go to reactions and touch something. Touch a flower, touch an ice cream. Thumbs up. Yeah, thank you. Awesome. Now, how do you use the reactions? You simply go to where you have reactions. You go to the 3 dots. If you're using a phone, click on reactions, and then you will be able to see what you can do. You can clap, you can laugh, you can give a love, whatever. You can give a flower, and so on and so forth. There is so much that we can do. Let us start making use of the E icons to appreciate our colleagues. Thank you very much. That was a good presentation. Group 6, where are you? Group 6. Room 6, we had Alvin, you are in room 6. Masi Ogechi, you are in room 6. Ogembo, you are in room 6. Unmute yourself. Who was your secretary? Mitaru, you are. You're breaking. Sweet Roses. Is that your name?
Citrus, yes.
Okay. What did you discuss?
We were in group 5.
Okay. No problem. Continue. Group 5.
Yes, teacher. We are at a group 5. And we came to an agreement that health literacy determines the health of a person. No, I cannot understand this.
So did what you have written.
Okay, determinants of health. We came up with the nutrition. What you eat determines how healthy you are. And then we also came up with the lifestyle. We brought up a point of medical care, the drugs. We also came to the point that it is your health will be determined by the environment. The pollution can determine the pollution in the environment. How good your environment is, where you are living in, can determine your health. And then we also came up with the genetics as the determinant of your health. And then occupation. Occupation, what you are doing, it can be hazardous or how healthy your environment is can determine at your place of work can determine your health. And when we came to what we want to know, members wanted to know how to improve their health and how it can be incorporated in our teaching subjects. And I think that is what we came up with. Thank you very much, Daktari.
Well, thank you very much. And at the plenary, we had a team at the plenary. Tell us what you discussed. Jasmine and team, you had a very good discussion. Jasmine,
Dr. Christine, you want? Yes.
Yeah,
hello?
yeah, please. Share what you discussed.
We were talking about health literacy has to be holistic. It has to honor the socio-emotional aspects of the children.
Sorry,
psychological.
Jasmine, a second, please. Forgive me. Please let us appreciate group 5.
Sorry.
Yeah,
okay.
Thank you. Yeah, thank you. Let us all give group 5 flowers, thumbs up. Let us clap for them. Use the reactions. Yeah, thank you very much. Use the reactions. Awesome. Thank you. Okay, Jasmine, continue.
Yeah, we were talking about health literacy encompasses different aspects, emotional aspect of the person, psychological aspect, physical aspects, and spiritual aspects. Also, it is very holistic. Health health has to be very holistic. So socio-emotional, psychological, physical, and spiritual. As much as we have to be very conscientious that the children, we should be, that the children should have be healthiest and be at their best with the health, it is even very important that the teachers are at par with their own health, because if the teachers are not well, then they cannot be able to take care of the children. In the school, they have to have different areas of health where they have to focus on hygiene. Hygiene issues are very, very important. Health should be all round. including, okay, we have the teachers, we have the students, then we have to have the, at least everybody's health has to be at par, including the support staff. Because especially when you think about the COVID issue, cleanliness was the most important aspect. Even the parents should be regularly invited to come to the school and guided on all these issues. And at the same time, it's very important that the school keeps a full record of children's vaccination and guide the parents what's due, what's not due, have all the addresses and contacts of the nearest places, hospitals where the children can go for their immunizations and everything. Even health practitioners should be invited to school as guest speakers to guide the parents and even the children who are a little bit older than the early years ones. It was difficult to discuss so much more because it was only me and one of my colleagues who were discussing. Everybody else was quiet. And I think we even had connection problem and we started a little bit late.
Thank you very much. Let us appreciate Jasmine. Thank you, Jasmine and team. Yeah, I saw you and Captain really discussing as the others decided to be silent listeners. Let us appreciate them. Thank you for the good work. Okay, finally, group 10. Group 10, where are you? Group 10, please unmute. In group 10, we had Florence Agutu, Caroline, Winnie Otieno. Who was your leader? Who was your leader, group 10?
Hello, kindly, if group 10 is not there, group 6 is ready. Kindly.
Okay, group 6, let's go.
Okay.
I like that. That is a good collaboration.
Thank you, madam. Okay, yeah. So in group 6, yes, this is what we discussed. Unfortunately, just like Jasmine just said, in group 6, we had a bit of an issue with identifying our leaders and our leader and the secretary, because most of the members were quiet, and also for the secretary, most of the members did not have the ability to write or record anywhere. So those are some of the challenges that we faced. So I happened to be the leader and the secretary at the same time. So this is what we deliberated upon. Sorry, I've remembered. The other issue was some members didn't get the question correctly. So I took a bit of time trying to explain to the rest what the question was. The question was to say what we know on the skills, knowledge, attitudes of health literacy and the determinants of health literacy. So we had to highlight this in a way. I had to highlight this in a way. I explained that it's about the health literacy is about having an ability to be able to read through or to understand and use various aspects of health in the right way, to be able to effect good health policies and practices in an institution or a school. So I explained that. Secondly, I highlighted, and another member also contributed to the same discussion that we had, that the determinants of health would be those things that would qualify, those things or aspects that would qualify that there is good health practice in a school. So ideally that contributed that in a way automatically as what we knew about health literacy and the determinants of health. Number two, a member contributed on the knowledge or on what we know on the K section, that this health literacy would involve having the ability to use health technology e.g. the use of equipment like diabetes monitors, blood pressure monitors, and I contributed the use of an inhaler for those who are asthmatic. So that was one aspect on the skills. Of course, we had the aspects of skills, knowledge, and attitudes. And I think that should have been explored exhaustively, but again, because of the limit of time, the knowledge bit and the attitudes bit may have not really been that looked at. Secondly, a member contributed that we need to have skills of understanding health prescriptions on drugs, on the use of drugs, the use and administration of drugs to people who are sick. So health literacy involves, in a way, according to that member, the ability to have skills and use them to administer prescriptions, give patients or give students who are sick medications. Another one identified the skill or the ability or the knowledge of understanding instructions, the doctor's instructions on medicines. For example, the 1x2 that is written on the medicine packages, the 2x3, 4x4. This, in a way, amounted to the health literacy, according to our understanding. On the bit of what we wanted to know, we went back to that particular question and we said that we want to know for real, what is health literacy and how does it help teachers in schools? We want to really know what this health literacy is and how it helps teachers. Also, consequently and consequent to that, we also wanted to know what are the health determinants. Again, how do they help teachers in ensuring good health and good practice in school? So those were the deliberations we had. We were cut short by time because of the slow responses from the members. But otherwise, I believe we'll improve as we go. Thank you.
That was really rich, yeah? Let us appreciate Philemon and team. The remaining groups you will discuss because the system will take you to the same rooms. When we'll have another breakout room, I will allow the other groups to also share their insights. Now, let us now get into the nitty-gritties because you've already told us what you want to know and what you already know. So, because finally Philemon came out clear and said that they want to know what is this really, what is health literacy, and what are these determinants of health. That is quite awesome. But before we get there, why is health literacy important in learning institutions? From the insights that you came up with, let us use the chat. Let me see one or two people give an answer, then we proceed. Is it important? Is it important for us to talk about health literacy in our schools, in our colleges? Is it important in our learning institutions? I'm looking at the chat. I just want 2 answers, then we continue. Oh yeah, we needed to have appreciated Philemon and team. Please, sorry, I forgot. Let us first appreciate Philemon and team. And then Kipkachi has said it is important because it helps teachers to address health-related issues in an institution. Yes, thank you. Thank you. Why is health literacy important? Thank you for appreciating, Carol. Thank you, Akinyi. Thank you. Yes, Sister Rachel, you're saying yes, it is. Maybe you can voice your answer. Sister Rachel, please raise up your hand so that I have you at the top. Khadija Rajab, you can unmute yourself and air your views. Khadija, unmute yourself. Okay, Sister Rachel, please unmute yourself because your yes, it is very strong. Tell us why you think it is important. Unmute yourself, sister. Sister Rachel, are you there?
Yes, I'm there.
Yeah, why do you think it's important?
Yes, it's very important to, for this health literacy in our learning institutions, since we are all prone to becoming ill. We are all prone to, having situations that would put us down physically, mentally, socially, and therefore, once we are connected and we are, have this literacy on health issues, we'll be able to tackle both for the learner and also for the teacher. That's my feeling.
Wow, thank you very much. Thank you very much. Now, as she has said, in other words, we can say health literacy will have an impact on even the educational outcomes, such as learning achievements, academic competencies, the competencies that we are talking about, for example, in CBC, like critical thinking, problem solving, communication, and collaboration, that once the learners get to understand matters health, they can come out clear and talk about how they are feeling and what needs to be done for them to be safe. And it will enable learners to become empowered individuals as well as ethically and socially responsible citizens. So that even if you are not there, the learners will be able to keep their classroom clean. Yeah, because they know a clean classroom will promote their matters of health. Now, before we get to talk about health literacy, it is important to just talk about literacy. Yeah, what is literacy? We could be talking about some terms and without necessarily going deeper to unpack certain terms, it will not be very easy for us to get to understand. Yeah, the kawaida definition of literacy is the ability to read and write. Yeah, it enables one to use printed and written information to function in a society. And as we all know, literacy is a human right, and it can be considered as a tool of personal empowerment. When you are literate, you are empowered already. It is a means of social and human development. The government is therefore committed to promote availability and access to quality education and health to all, including our learners. So when we get to understand what literacy is, then it will be very easy for us to understand what health literacy is. Because health literacy has got to do with health, has got to do with information, has got to do with decisions. It has got to do with decision making. It has to do with action. Things have to be done, and it has to do with our health. Now, health literacy is the degree to which individuals have the capacity to, one, access, the ability to seek and obtain health information, two, understand, the ability to comprehend this information that they've accessed, three, process. That is now being able to judge, being able to filter, being able to evaluate this health information and also apply. Application is very, very critical and important because application has to do with the usage, yeah? The ability to make use of this information to be able to make informed decisions. If you know what is good in matters health, then you internalize, you understand, you appreciate that it is really important for us to do this because it is good for us. We will be able to live long, we'll be happy, and so on and so forth. Then we will now go along and make use of this information to be able to make informed decisions, informed judgment. Before you do this, you're able to say, I am doing this because I understand, because I know, yeah? Now, the importance of health literacy in schools, it enhances teaching and learning, because when we have these knowledge, attitudes, and skills on matters health in our schools, our learners will now be able to know what to do to remain healthy, and thus it results to enhanced retention and transition and prevents children from dropping out of school, because we now know what we need to do to have everybody, all the stakeholders, remaining healthy so that they can be able to continue with their academic work without major challenges. If it is the teachers, they are able to attend to lessons without really being ill. The health benefits of safe and adequate water, improvised sanitation and hygiene range from reduction in diarrhea, intestinal worms, and eye infections, and so on and so forth. It even goes down to thinking about the number of washrooms that we need. What is the ratio? What is the ratio, for example, in a boys' school? What is the ratio in a girls' school? The ratio of learners to latrines. How many? How many learners for one latrine? Who can just tell us? For boys, what is it supposed to be? Let me see through the chart. For boys, how many boys for one? How many boys for one? Somebody just write that answer using the chart, 1 to 25, 1 to 25. What about girls? What about girls? You're now guessing. I think now you're guessing. I want to challenge you to go and just do some Google search. For girls, it's 1 to 25. And boys? No, it's not about depending on the level of learners. Girls 1 to 20, boys 1 to 30. Okay, now we are guessing. Let's go and use our phones to become smart. Yeah, of course, for girls, there'll be lesser girls than boys. Yeah, because of the many challenges that girls have. Good. Health education, therefore, enables learners to develop life skills as values imparted onto them, eventually translating to national health culture. Improving health literacy is really important because it brings the greatest educational benefits to the poor and the most vulnerable, as in the case, for example, of deworming or even immunization of some sorts like polio and so on and so forth. And thus interpreting medical reports in learners' personal files and taking necessary action is also very critical. This was really vividly discussed in your groups. Now, this is just an activity that we can discuss at the plenary. A mother visits a health center with a sick child. She was given drugs and was asked to take the child back after a week. The prescription given was to last 5 days, yeah? By the second day, the mother went back and said the drugs were finished. and the child's condition had deteriorated. On the prescription bottle, the doctor had indicated 1*5. What does this narrative mean? What does this narrative mean? What does this narrative mean? Let us use the chart. Let us use the chart. What does this narrative mean? Mike Benson. Mike Benson. Aquila, when you see somebody's hand up and I've mentioned their names, please unmute themselves as soon as possible. Mike, please unmute yourself. Then Rebecca Kisiangani. Okay, yes. Yes, Mike.
Thank you for this opportunity. I want to contribute by saying that according to me, the prescription given was that the medicine to be taken was once after every 5 hours or once every 5. So according to me, maybe this parent or this mother did not have the knowledge on how this medicine was to be given, or maybe never understood the doctor's prescription. That is why we find that after the 2 days, the medicine had already finished and the baby was more sicker because of drug abuse. Whereby you're saying that the baby was given an overdose. So because of the overdose, that is why the health of the baby deteriorated. And again, the dose that was given, that was supposed to last for at least 5 days, you can see it lasting for only 1 day. 2 days. So I think the mother does not have this knowledge on how the dose should be given. That is number one. Number two, maybe she never understood the prescriptions or the instructions given by the doctor. That is why she ended up giving the dose for 2 days, and the baby's health deteriorated.
Yeah, thank you very much. Let's have Rebecca now. Unmute yourself. Rebecca?
So as Rebecca joined, Captain is here.
Okay, Captain, continue.
I think for me, I'll look at it in 2 dimensions. One, I will not say the mother ignored, but I'll rather say lack of literacy. Then on the other side, the medic failed to offer the literacy. So that's why I would say this health literacy is very important. Thank you.
Thank you. So what did the doctor want? How was this medicine supposed to be given to the child?
I think the doctor prescription, according to how I understand, in my own opinion, I can say the patient was supposed to be given 1 per day.
Per day for 5 days.
So that
and what did the mother do? Gave 5.
The mother gave 5 in 1 day, which maybe was part of an overdose, leading to deterioration of the health.
Good. Now that leads us to the next question. What is the importance of health literacy? Unmute Bernard Akinyi. This is Bernard Mary Akinyi.
Yes.
You can speak.
Yes.
Answer for us the second question.
Yeah, the importance of health literacy is to avoid the occasion of overdose, and also it's enable the guardian of the patient to follow the instruction properly. And also the importance of literacy is also enable for the instruction to be taken appropriately, and for the patient to be guided accordingly. And also literacy can also facilitate to challenge some other, it depends with a community, you can challenge some issues that need to be corrected medically that is being taken for granted. You can challenge in an appropriate way. And you can also be, the importance of literacy to be educator to others. Thank you.
Educator to others. Thank you very much. Well. It is important. It is really important for the doctors to explain further. Sometimes some drugs will require that you take them after you've taken a meal. Others will require them that you take before 30 minutes before you take a meal. It is important. It is important for even our learners to get to understand that even if they are young, when they get sick and their parents have been given medicine and they've been told how many to take and how to take, it's important even for the children to get to know and even ask, am I supposed to eat first or am I supposed to take the medicine first? Health literacy is really very important. So we have quite two aspects of health literacy that are critical and important to look at. The first one is the personal health literacy. And then we have what we call organizational health literacy. Just from the way they have been labeled, personal health literacy. Personal has to do with a person. Organizational has to do with the whole school, the whole community, the whole institution. Now, every person requires the ability to comprehend health information given to them by any health service provider. It also means that people require the capacity to tell when their bodies are not functioning at their optimum, yeah? It is important to know when you are not okay, yeah? When you feel like you are straining what you need to do, it's important. Learners require health information about themselves and where to seek for help when need arises. It is sometimes very painful when a child goes to a school nurse and the nurse, when the child tells the school nurse, nurse, I'm feeling this way and this way, the nurse dismisses them and they're like, wewe umeogopa mtihani, hiyo ni examination fever. I don't know if you've had such scenarios in your institutions, that the learners are chased away, especially during exam period, and they are not attended to because the nurse probably imagines that during exams, there is anxiety, and so the children will want to say they are sick when they are not sick. It is important for the health, the people offering health services to listen to all the learners. Yeah, let us not just assume that they are running away from exams. Now, when it comes to organizational health literacy, we are talking about the whole organization as it is. One of us discussed about having to do with the staff, support staff, the teaching staff, the learners, the parents, and everybody else, all the stakeholders. A school is an organization and should be private to the government insurance and communicate the same to the staff and parents. It is important for the leaders, the school administrators to give the information on government health coverage, like NHIF for learners, especially like now we have our learners in high school, that is secondary schools, are well covered when it comes to matters on National Health Insurance Fund and availability of other health services that will be available and can benefit the learners. It is important for us to communicate this information to the parents. We have factors that are critical to organizational health literacy. The first one is enhancing communication with learners and families on health-related issues. Let us not assume, we shouldn't assume that they already know. it is important to communicate. It is important to tell them, even if you think they know. Another one is to provide healthcare services in the school. Another one is encouraging learners to engagement in the healthcare process, building capacity of staff, just having a session for capacity building on matters health for the staff, both support staff and teaching staff. Let's have somebody who is conversant with matters health being invited to our learning institutions to talk about anything to do with maybe blood pressure, to do with diabetes, to do with HIV and AIDS, to do with abortion, to do with early pregnancies. All those are matters that are health related. And then creating a school culture and infrastructure supportive of organizational health literacy. For example, commitment of leadership. The board members, yeah, are they committed to support, to have a school culture, and to maybe have a school what? Is it sick bay, or even a hospital, a clinic, a school clinic, and so on and so forth. And also to come up with policies that guide the institution on matters health and health literacy. It is also important to have the institution meeting learners' health needs, such as provision of special diets, hot bathing water or hot drinking water, and then checking their prescriptions of maybe medications given to learners who are sick, and generally general medical checkups. Even as we talk about this, digital health literacy is also very important, because digital literacy has to do with the ability to seek, find, understand, and appraise health information from electronic sources and apply the knowledge gained to address or solving a health problem. Sometimes we feel so uncomfortable when we get to a hospital, and when you've explained how you're feeling to a doctor, the doctor takes their phone and starts to Google. Yeah? Before I knew, I used to feel very offended. I used to feel like this doctor doesn't know what she's doing. This doctor is just guessing. That is the right thing to do. Consultation. It is important to consult. Even if they know, before they make any decision to give you any drug, when you see them going online, be happy, because this doctor wants to be sure what kind of medication they're going to prescribe and how you're going to take that medication. So don't feel bad that the doctor is going online. And so even us, when you get medicine, when a doctor tells you this is the problem that you're having, this information is available online. Go electronic and learn. Get to understand your condition and how you can manage it and what you can do, and so on and so forth. There is nothing bad with that. Importance of digital health literacy is to empower us to better track, manage, and improve healthcare in order to reduce inefficiencies in healthcare delivery, improve access, reduce costs, increase quality, and also make medicine more personalized. Though, of course, don't treat yourself. Don't treat yourself. Now, when it comes to matters numeracy, it is important. Let us, for example, look at this. A learner came to school with a bottle of prescriptive drugs labeled 2 times 1 when needed. Yeah, 2 times 1 when needed. I should have highlighted that. The school nurse was to administer this drug. The learner visited the nurse every day, insisting he was feeling unwell. The school nurse got concerned and called the doctor for more information. What do you think was the concern of the nurse? What do you think was the concern of the nurse? Good. Raise up your hand. This one we need to discuss. What do you think was the concern of the nurse? Who wants to try? Who wants to try? Mary, your hand is up and you're the first one. Allow Ayua. Yeah, Mary talk and then Ayua.
Yes. Daktari, the concern of the nurse here, you see, as you said, were needed. You see that the drug here is level 2 times 1, and the underline here were needed. That means it's a case where when there's the persistent of the disease is when it is given at that 2 times 1. So the school nurse call for more information to clarify. Does this mean that it is morning, evening, or it is morning, evening only when only when maybe the condition of the patient increases? Thank you.
Thank you very much. Ayua? Ayua?
Yes, hello.
Yes.
I had the same thinking. The madam who has just left the floor.
Okay, now you can answer for us the second question. What is the difference between 2 times 1 and 1 times 2?
Of the nurse is when the drug is when as in a day or time or in a month, and say when is it dead or what kind of medicine was that?
Thank you. Can you now try the next one? Because okay, let's have somebody else.
So the concern is when needed.
When needed. Okay.
Hello.
Good. Let me have Neon. Neon Ray, unmute yourself.
Hello.
Yes. What is the difference between 2 times 1 and 1 times 2?
The difference.
Yes. What is the
between
difference?
2 times 1 and 1 times 2? If it is them two tablets once in a day, or you are supposed 2 and then times 2, you're supposed to take 1 tablet 2 times in a day.
Okay, thank you very much.
Okay.
Zeluia, you want to add something?
Yeah, I just wanted to say what she has said. 2 times 1, it means you take 2 tablets once in a day, maybe in the morning only or in the evening only. But 1 times 2, it is 1 tablet twice a day. One in the morning, 1 in the evening.
Wow. Now, without explanation, will everybody understand this?
No.
No. Thank you very much. Thank you very much. Now, numeracy is important. It is important when the doctors write 1 times 2 or 2 times 1. It is important for them to explain what exactly they mean, because numeracy describes a person's ability to understand medical data. It includes possession of specific skills, for example, calculating the right dose of a medicine, following directions for fasting before, for example, surgery, or checking a nutrition label to make sure an item is safe for someone with food allergy, and so on and so forth. So when it comes to matters numeracy, there is so much that goes into it beyond just the prescription that this is 1 times to be taken 1 times 2 or 2 times 1. Now, we need to talk about the determinants of health. When we look at the determinants of health, these are the economic and social conditions that influence the health of an individual as well as the community. They are actually non-medical conditions that affect learners, and these conditions include personal, social, economic, political, environmental, etc. factors that influence the health status of an individual. Yesterday, you talked about, we were talking about mental health. And we realized that mental health does not necessarily have to be a medical condition, yeah? Mental health can emanate from what is happening around us, social factors. It can emanate from economic factors. It can emanate from environmental factors, and so on and so forth. And so we have different categories of determinants of health. The first one that we are going to discuss are the policies. Yeah, I heard somebody talk about that, say that you want to know the legal frameworks. Okay, when we are talking about matters health, we have quite a number of legal frameworks that guide us on how to go about matters health. And so that becomes part of the determinants of health. The goal of health policy making, sorry, is to protect the health of individuals and the community. And that is why even in our learning institutions, we need to come up with policies that guide us on matters health. Health policies have to include everything, including even dressing. When it is hot, yeah, all learners should remove their jumpers or their sweaters. When it is cold, all learners should put on their jumpers. On matters cleanliness, classrooms, matters cleanliness when it comes to washrooms or toilets, and so on and so forth. We need policies on matters visiting the sick bay. Who is supposed to go to the sick bay? At what time? When must you be rushed to the sick bay? What needs to be done on matters first aid, and so on and so forth. All those are things that need to be mentioned in our institutional policies. Institutions of learning can accomplish these objectives by ways that respect human rights, including the right to self-determination, privacy, and non-discrimination. For example, we have the Kenya Health Policy, that is 2014 to 2030, that gives direction to ensure significant improvement in the overall status of health in Kenya, in line with the Constitution of Kenya and other global commitments. When we talk about other global commitments, at the moment we are talking about Sustainable Development Goals. Now, which goal talks about health? Look at goal number 3. What does it talk about? Yeah. Goal number 3 is basically looking at matters to do with good health. So use your smartphone and Google Sustainable Development Goals and look at goal number 3. You will see what it says. Another determinant are the social factors. Social factors are known as social determinants of health and refers to conditions in the environment where people are born, where people live, where people learn, play, worship, work, as well as age, that affect a wide range of health, functioning, and quality of life, outcomes, and risks. These social determinants include, let's talk about physical environment, our neighborhood, employment, social support networks, as well as access to healthcare and physical environment, social economic status, education, religion, and so on and so forth. And thus, addressing social determinants of health is very important for improving health and reducing long-standing disparities in health and healthcare. So this is just a diagram that gives us the picture of what we really mean when we talk about social determinants of health. All these, they've been labeled rural social determinants of health. Matters to do with education, food, environment, transportation, housing, community infrastructure, matters to do with the ethnicity, income, and so on and so forth. You'll want to ask where there is ethnicity there. Last week, we were carrying out some survey, some study in one of the counties in the country, and I was really mesmerized. When we got to school and we were asking learners whether they have missed school, and they were giving us reasons as to why they missed school. In one particular school, all the learners who said they missed school, they said they missed school because they were sick. Okay, I followed that with another question. When you were sick, were you taken to hospital? All the students, all the learners said no. Then I asked, then how did you recover? They said we were given traditional medicine, all of them, that they are never taken to hospital. The best that can be done for them is to be given traditional medicine. They recover, they go back to school. That is why matters ethnicity are critical when we talk about social determinants of health. Now, let us look at this case study. Yeah, we are going to have so many of these for this particular session for us to really internalize and understand what health literacy is all about. Now, I want to request one of you to read for us this case study. Who can do that for us? Raise up your hand. The first one to raise up their hand, we read. Okay, Catherine Nyakuri. There you are. Where is the boy child in the house? What is happening? I'm only having the girl child. Okay, Catherine, continue.
Yes, thank you, Dr.
Yeah.
Case study. Members of the Kabonokia sect from Tarakaniti have fled their homes in a bid to avoid polio vaccination for their children, citing their religious beliefs which are against the use of conventional medicine. An article, Vaccine Confidence Project, revealed that most of the parents had fled to Kitui County with their children. A resident, Mr. John Mutegi, told nation.co.ke that during the last vaccination exercise, many members of the sect crossed over to the neighboring Sekuru and Mumoni districts in Kitui with their children until the program was over. Adapted
Good.
from
Thank you very much. I hope you've understood. I hope you've understood this case study. Just take a few seconds, look at it, then now I will bring on board the questions. Silent reading for 1 minute. Good. Now these are the questions. How can religious beliefs influence health decisions made by parents? How can religious beliefs influence health decisions made by parents? I've also given you a story of what I found out last week. Okay, let me see the hands coming up now. We are now answering Carol Nyongesa. Carol, you disappeared. Okay, Carol, unmute yourself.
So thank you for the opportunity. Now, the decision or parents' decision can be one good, like the situation you gave a few minutes ago, or it can be bad. Like sometimes, once in a situation, a real life situation, a boy fainted. I rushed the boy to the hospital, and when the boy came up, the first thing he brought forth was a card written, I don't drink blood. And that boy was anemic and he needed blood urgently. So because of that issue, one belief and religious, and because of whatever they believe in, it can make somebody's life different.
Okay, thank you, Carol. Hata kama you were cracking. Thank you, Carol. Kisiangani, unmute yourself.
Thank you, Daktari. The religious beliefs, they can really influence the health decisions, because once somebody has these beliefs, they are usually regarded to be very supreme. They don't want to do something against their faith so that they can miss heaven. So sometimes they are so strict, such that, like in the case, if they are being taught, like in this case study, it's a sect, meaning that their teachings are contrary, or they are a bit unique from the common things that you already know, maybe from the normal knowledge that we have. So if they are so strict, or they are they're very strict with their faith, they are so rigid that if you are, for example, you are not a member of their faith, they may not really buy your idea. You seem like for you are not like going to their heaven in quotes, so you really don't understand them. So religious beliefs are very strong, and if parents believe in them, it may be hard to convince them to do the conventional. Thank you, Dr.
Wow, thank you very much. Bernard? Oh, Peter, sorry, Peter Oeri. At least now we can hear some bass. Thank you.
Yes, yes, thank you.
Yes.
Yeah, influence of religious beliefs on healthy decisions. To some extent, positive. Allow me share a bit. I am an Adventist, Seventh-day Adventist believer. What we teach, particularly if I could be allowed to state, like when it comes to growing vegetable, which is good for health, we advocate more of homegrown vegetable as opposed to what is bought. Reasons: sometimes you buy vegetable which has been sprayed and the people don't care. They want to sell anything as long as they make money. And that may go a long way even in making others sick. I know of a lady who had sold all her milk because she had vaccinated her cow. And again, she went to wait for those who have good milk to buy and go to use at her home. So for that reason, normally what we Adventists advocate, if people could choose, is to have homegrown vegetable or even rear your own dairy or something of that kind, for the simple reason that sometimes what we buy from the markets, you never know its origin. Sometimes it has gone a long way to cause diseases. So in a way, that influences maybe the way we behave, or rather the way our health is. Thank you.
Thank you very much. Teresa, your hand was up. Where did you go? Thank you very much. Thank you very much. Okay, let's now talk about the next question. What is the role of education in alleviating such scenario? Cases where religious beliefs influence health decisions made by parents. What is the role of education? What is the role of education? Let me see. Okay, Zeluya, unmute yourself.
Okay, in this case.
Yes, continue.
In this case, education is very important. For example, if I take an example, there's this religious sect that believes that the ladies should not use any family planning. They should just give birth. But they don't see the implication later. How are the kids going to be brought up, the resources? But once the education comes in, the women are taught you should control giving birth so that you can be able to get the resources to bring up the kids, to cater for them. So when they become enlightened, they'll come to embrace the health matters rather than relying on the religious part.
Wow,
So the education enlightens them.
Okay. Thank you very much. Davis? 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 Unmute yourself. There was Davis and David. David Munene, unmute yourself. The same people are raising up their hands. What about the rest of us? Okay, let's have Wycliffe Obare so that I have a boy child speaking also. Wycliffe?
Good afternoon.
Good evening.
Good evening.
Yes.
The aim of health is to equip people with so as to deal with life issues pertaining to health. Another one is to expose people of knowledge and health. Also, it can be to take some addition, hence adoption of new knowledge. Do you heard me?
Yes. Thank
Hello.
you. Thank you very much. Yes, thank you very much. Okay. Now let's talk about health services. Now, what are health services? What are health services? Health services, of course, consist of medical professionals, organizations, and healthcare workers who provide medical care to those in need. When we go to the hospital, we go to the hospital because we need health services. When we go to the sick bay, we are going to the sick bay because we need health services, and so on and so forth. And so the people that are working there, the health workers, they're the ones who provide this. And basically, most of them are professionals. That is why we will take whatever they tell us as the truth of what is expected of us. Now, schools should offer health services like school clinic. For nurses, we must employ nurses who are trained, not just anybody. A matron is not a nurse. We need to think about providing first aid services, hand washing facilities. Hand washing facilities, we are doing very well in our schools. Even those that cannot afford permanent taps, we have improvised. We have used jerry cans, made some hole with a nail, so somebody can remove the nail to wash their hands. We need enough sanitation stations, as we said, for boys. The ratio is 1 to 25 for girls. For boys is 1 to 30, for girls is 1 to 25. And psychosocial support for matters mental health for learners. The school should have a working relation with local health facilities and workers for referral of health issues. Don't have a bad record in the neighboring health facility that is just neighboring your school. Have a good relationship with them. Then we also need to look at individual behavior, because individual behavior plays a big role in health outcomes. Some health issues call for individual change and adaptation of behavior. For example, if an individual quits smoking, his or her risk of developing heart disease is greatly reduced. So when we know that smoking increases heart disease challenges, then it is upon an individual to decide by themselves that I will stop smoking. Many public health and healthcare interventions focus on changing individual behavior, such as substance abuse, diet, and physical activity. This is very critical, especially when you get to some age, 40 years and above, you find yourself adding weight. The gentlemen start having stomachs. Then you are like, this is healthy. It is important to look at what exactly is health. What exactly is healthy? When it comes to diet, what do I need to eat? When you go to the hospital, when they measure your weight, they will tell you whether you are overweight or underweight, yeah? By looking at your height and your weight, they will tell you, now go reduce. Like 3 months ago, I was told, well, this is too much. Go reduce 15 kilos. Then, hey, it is really taxing. Even reducing 1 kilo, it's not that easy. So I had to look for somebody who can advise me on the diet that I need and how I need to feed. And when I was told to try this, stop eating carbohydrates at night, I started at some point, I'm like, nasikia njaa usiku. But with time, when you get used to it, you see the results, you are happy. Then positive changes in individual behavior can reduce the rates of chronic disease in this country. So individual behavior is very important, because individual behavior will give the true results that we are all looking for. So if we all get into looking at our individual behaviors, then we will be able to remain healthy. Now, this is another case study. The people who have been raising up your hands, don't get tired. You will all speak, because I have quite a number of case studies in this session. Now, this is another case study that I want one of us to read aloud. One of us to read aloud. And now I want to request Nancy Wagatwe. Nancy Wagatwe, please read the case study for us. Then Josiah, you'll be the first one to answer the questions. The first question. Nancy, unmute yourself. I've given you rights. Nancy, are you there? Okay. Nancy has not unmuted. Let me ask Sister Rachel Kariedi. Please unmute yourself, sister, and read for us.
Yes. Yesterday, as young as 13 years, are smuggling up compound in a national shame that has become captured in a new countrywide government survey. For the campaign against alcohol and drug abuse in Uganda, survey also reveals that students are using all tricks possible to abuse drugs during school visits, entertainment, or at night in their dormitories.
Yeah, I don't know if this scenario is familiar to us. I know of quite a number of schools that are really struggling with issues to do with alcohol and drug abuse. I don't know if your school, you are safe. Now, how are the learners' choices influencing individual behavior? Please mute yourself. Okay, let me see. Monica Njenga, unmute yourself. Monica Njenga, unmute yourself. Yes. How are the learners' choices influencing individual behavior?
The learners' choices influence their behavior, because when they make wrong choices and indulge in such activities using drugs, it changes their behavior negatively and their lives are destroyed.
Mm-hmm.
And therefore, this influences, it changes the way of thinking, it changes their decision-making aspect and abilities, and therefore the character is also affected.
Oh, thank you. And then Lefensi Ondoro has said lack of concentration. Let me see another person. Salome, unmute yourself. Salome, unmute yourself. Salome?
Okay, if I may answer.
Yes.
The learner choices may influence individual behavior because as they stay together, they tend to discuss and they always agree. And at the same time, if you get the person who do not have personal stand or who is not convinced of his or her own life, may follow the trend and may find him or herself in a problem. That is what I can say. Asante Daktari.
Thank you very much, Salome. Who is next? Josiah. Josiah, please unmute yourself. Josiah, can you unmute yourself? Okay, the chat we are having: use of drugs, compromise sound decisions, peer groups, lack of concentration, poor study behavior. Josiah, you are ready to speak?
Yes, good evening.
Yeah, continue. Good evening.
Yes, I think the learner's choice influences their individual behavior because it affects, one, their performance. It lowers their concentration in academics. Two, I think when they go to the drugs, it affects how they think. Their thinking capacity goes down. Also, it affects their social characters with how they associate with others. The way they think, the way they talk with others, even including the teachers, they behave differently. Also, it also affects the change of behavior. They change completely. Even bathing, cleaning, organization of their work in class is affected. So I think their choice affects their individual behavior. Thank you very much.
Thank you. Thank you very much. Peter says education provides, is it that? No, I'm seeing, okay. Purity says behavior changes will include truancy. Truancy, I was trying to read and then it disappeared. Let me read, okay. Unhealthy, okay, Esther Wambui says unhealthy lifestyle like drug abuse, which lowers their retention capacity in studies. They become arrogant, poor relationship with peers, cause the family to suffer, can lead to poor performance, dropping out of school, absenteeism from school. Unhealthy lifestyle like drug abuse, which lowers, that one has already been read, can lead to poor performance. And then poor behavior, become indisciplined and have poor relationship with teachers and other students. Thank you very much. Now, Stella, what is the role of the teacher in influencing individual behavior change of learners? What is the role of the teacher in influencing individual behavior change of learners? Stella? And
the role of the
Thank
you, Daktari.
Yes.
I think the role of the teacher comes in to remind the child that there are choices that we have to make in life, and each choice has every choice has a consequence. And then there are also possible choices that they have to make at their age, and possible solutions that also have to come in at their age. But above all, I think the best counselor and parent at this point is the teacher, because most of the students open up to us I have a student who tells me she was just away from home forgetting a child, and they were to make a choice between her leaving the home or the mother and all the children leaving the home. Eventually she left and went to stay with a friend, and it has not been easy. We are struggling with her academically, but she's coming up, not very bad. And at least even the rate of absenteeism has gone down on this particular child. So if the child, if the teachers can take their time to remind the learners, and I think I choose the word to remind the learners and educate them on every consequence that may come up in relation to the choices they make, either as individuals or as peers, and sometimes even as a family in regard to their education. Thank you, Daktari.
Thank you very much. I want to see if there is anybody else who has raised up their hands. Apart from the, okay, Susan Rukwaro. Susan Rukwaro, unmute yourself.
Yes, I think it is the duty of the teacher at least to try to guide the child the dangers of the use of the drug, and in case if at all they have the like video scripts that shows the danger, giving the forms of the danger of taking and how harmful they are, then the child will be easy to learn from that. Thank you.
Wow, thank you very much. Thank you very much. There is a lot of learning here. And then another determinant is the biology and genetics. This is very, very important. Some biological and genetic factors affect specific populations more than others. For example, older adults are biologically prone to being in poorer health than adolescents due to their physical and cognitive effects of aging. That is why when we see our parents aging, we start getting worried, because the more you age, the likelihood of getting chronic diseases, for one, for example, things to do with hypertension, diabetes, and so on and so forth. Younger children are prone to diseases more than teenagers. Why? Because the immunity is not yet that strong. That is why we are always told that if a child gets to age 5 and above, they are better, they are okay. But below age 5, the parent has to really take care of this child before they can really stabilize in matters immunity. Now, examples of biological and genetic determinants of health include age, sex, HIV status, inherited conditions such as sickle cell anemia, asthma, diabetes, albinism, and so on and so forth. Those are what we call biological and genetic determinants of health. Now, there are some health issues that affect learners in school. There are many ways of finding out the health issues of learners in your learning institution or in your school. Now, what are some of the ways that the school can use to gather information about learners' health? And how is the school supposed to deal with this information? I think the two questions can be answered concurrently. The two questions can be answered concurrently. I want to see a new hand. I want to see a new hand raised coming up. All these people have spoken. Let me see new hands coming up. As I told you, this conversation today has quite a number of discussion points, and it is us to discuss. Team Clean Heart. Okay, Team Clean Heart. Is that your name or your nickname? Because all teachers have got nicknames from students. Unmute yourself, Team Clean Heart.
So, about this.
You have 2 gadgets in your room, clean and close one. Okay, General, unmute yourself.
Hello, thank you, Daktari. One way of finding out the health issues of learners in one's school is through observation. You just observe the learners. You can tell through observation whether a learner is healthy or a learner is ailing.
Okay, keep catching.
On the ways that a school can use to gather information about learners' health, one is you can engage the parent, especially during admission of a new student to a school. You ensure you check the health background of the student. Then also along the way, you also check the frequency of how frequent does a child get ill. Maybe finally, maybe as a class teacher, you can also be very close to the students so that you are able to, so that they open up and be able to share with you maybe the challenges that they are, the health challenges they are undergoing. Thank you.
Thank you. How is the school supposed to deal with this information that they gather from the learners? Abida, George?
Yes. One, the information that is received from the learners must be treated with a lot of utmost confidentiality. And then they are supposed to be used to seek for any intervention that would help the learner get out of this, maybe from the medics or any other source that would allow the learners manage the condition that they are going through, especially if they're coming from backgrounds that are modest or humble, so to speak.
Thank
Yes.
you, Lucy. Thank you, Lucy. Lucy Wanaina, unmute yourself. As Lucy unmutes, there's quite a lot of discussion going on the chat. Please be reading as your colleagues write what they are writing. Emily says treating information as confidential. Peter says finding out about learners' health, asking them to biodata relating to their health, if they have any health-related issues, to enable school to attend to them in case of emergency. Redemptor says be confidential. Mary Kibuchi says have a questionnaire where you have specific queries regarding the issue you want to know. Tom says concentration of the students. Concentration of the students in class can tell if a learner has an underlying condition. Truancy and absenteeism can also be a factor to inquire about. So in essence, you are all saying that the information should be treated with utmost confidentiality. Thank you very much. Thank you very much. Now, what is a health promoting school? What is a health promoting school? We are talking about a learning institution that promotes health. This is a place where all members of the school community work together to provide students with positive experiences. This may include curricula in health, the creation of a safe and health school environment, the provision of appropriate health services, and the involvement of the family and wider community in effort to promote health. So that is why when we are looking at health literacy, generally we are looking at everything concerning all the stakeholders in the school, all the stakeholders in the learning institution. Ultimately, at the end of it all, we are talking about how
to utilize healthcare and how to have quality life. It is about being confident, that is self-efficacy, being engaged, being able to share decision-making facts, self-care, health promotion, education adherence, primary care access, use of preventive services, and so on and so forth. So when we have a school or an institution that can be referred to as a health promoting school, this is a school that fosters health and learning with all the measures at its disposal, engages health and education officials, teachers, teachers' unions, students, parents, health providers, and community leaders in effort to make the school a healthy place. This is a school that strives to provide a healthy environment, school health education, and school health services, along with school or community projects and outreach, health promotion programs for staff, nutrition and food safety programs. Now, talk about nutrition and food safety programs, and somebody said that at times, some schools give children food that has expired, food that is spoiled. You have a lot of food in the store, and because it is a lot, with time it spoils, and we give our children bad food that is really bad. Then opportunities for physical education and recreation, very important. That is why in the competency-based curriculum, physical education is one of the areas that is really having a lot of emphasis, that every learner needs to go to the field, if possible, every day. And programs for counseling, social support, and mental health promotion. We're also talking about schools that implement policies and practices that respect an individual's well-being and dignity, provide multiple opportunities for success, and acknowledges good effort and intentions, as well as personal achievements. We're also talking about schools or learning institutions that strive to improve the health of school personnel, families, and community members, as well as pupils, and works with community leaders to help them understand how the community contributes to or undermines health and education. So now getting to that point, I want us to go to our breakout rooms and just share freely. What are some of the health issues that face our learners, that face our colleagues, that face our parents, and how have we dealt with them? How have we dealt with them? I want to think about instances where we have students who are either infected or affected with diseases like HIV. How do we deal with them? How do we handle them? Yeah, how do we handle them? Now, Aquila, please give us 15, I think 15 breakout rooms can do. Yes, give us 15 breakout rooms for 10 minutes so that people can now go and speak. The reason as to why we have TPD, Teacher Professional Development Program, is not for the facilitator. It is for us to help us acquire the competencies that we need to acquire as teachers, and to be able to collaborate and communicate with one another, to share our views, to connect in the process. And so that is why we send you to rooms where you are few, so that each one of you can get an opportunity to at least to be heard, Aquila, are you in the room?
Yes, okay.
Yeah, thank you. So when you get to the rooms, let me see, we have, this is 1945. Give us 15 minutes. I think 15 minutes can do, so that we can have everybody at least say something. Each one of you to speak for 1 minute. Now, this is a free session for all of us. Please be free. Let us share the cases that we have handled and how we have handled those cases. It is an open question. Okay, let's go. Good. Those that remain at the plenary, as usual, we will have a discussion at the plenary. We'll have a discussion at the Yeah, at the plenary, we have Oginga, Redemptor. Redemptor, you can read the group. Duke Onchuru, we have Jen Gishangi, we have Mary Ngugi, Ndi, Oginga. Who can lead this group at the plenary? Who can lead the group at the plenary? I want you to discuss freely. I want you to discuss freely the cases that we've handled. Health is or matters to do with health. The cases that we've handled in our schools. Thank you, Elsie. Unmute all.
Yes, Daktari, thank you.
Yes, please lead the group, Elsie.
Okay, thank you so much. So, welcome members to this very wonderful discussion of our experiences in dealing with students who have had health-related issues. I would like to start by sharing my own experience, and I would like that if any other person has an experience, you put up your hand so that I'm able to.
Imperfections, blackheads. Patagonia is pure active 3-in-1 charcoal, powered by salicylic acid and purified charcoal.
Please mute. Galaxy. Okay, Elsie, continue. Elsie? Was Elsie thrown to a room? And then we are left without a leader. Okay, the people remaining, one of you to pick up the challenge of being the leader of this group. Elsie has been taken to a room. Who can lead? Yes. In Phoenix, what is your name? Please unmute yourself. In Phoenix? Yeah, lead the group. What is your name? Please rename your gadget. What is your name? I can assist you.
I'm Rael.
Rael, okay. You can now lead the group.
Thank you. Thank you, Daktari. I just wanted to say that some of the health issues of learners in institutions include those who have maybe like the girls, those who have abnormal menses. Sometimes they have those challenges, and during that period, they really suffer. And even attending to their lessons become an issue. Like one girl that I talked with recently who had that problem. So whenever the menses start, she just finds it so difficult, and she just either stays out of class dealing with that issue. Sometimes we try to help her and it becomes tricky. So what happens is that she has to go to hospital anyway, and get medication. Recently, she went and she was admitted for a whole week. When she came back, the problem still persisted. So that is one of the cases of the challenges or the health issues that learners have. And then another one is, this one is a bit, it was even strange to me. This is a boy. He came and he said that he has issues in his private parts, and he cannot walk, he cannot stand. So it became a real problem. And when we referred him to hospital, he went and nothing was diagnosed so far. So he went and he decided to go to the herbalists, who also are not able to treat him. Then finally, he's back in school, but still in pain. And even today, he was telling me that he's still in pain. He wants to go home another time. So those are some of the issues that affect the health of the learners. Thank you, Daktari.
Thank you. You can now continue leading the rest so that they can discuss. As I visit other rooms, yeah, you can be the leader of this group.
Thank you. So I don't know the members in this group, but is there anybody in the room with us?
Yes.
Yes.
Hello.
Christine.
Hello.
Christine is
Yes. Hello.
Sorry. Hello.
Yes.
Can I
Yes.
give an experience? Hello.
Yes.
Hello. Yeah, this is Christine. I wanted to say that I handled a case of an STI, a girl who really stayed with an STI problem for a long time and was shy to tell the parents, was shy to share with the teachers. And it reached a point where now the girls was sidelining her and stigmatizing her. So when she opened up to me, I took her to the guidance and counseling office. I spoke with her. I referred her to a health facility. She was treated. The matron took her there. She was treated and she came back and she was very grateful to me. And from then henceforth, she got her treatment fully and resumed her lessons normally, and the problem ended. Thank you. Hello.
Ryle, you are the leader here. Thank you, Christine. Ryle, please lead the group. Or Elsie, unmute yourself and
Okay, I think I can pick it up from there. Thank you. I would like to share my experience as well. About 1 week ago, I noticed that one of my students had a very dismal performance, a performance that was way, I would call it an outlying performance. It was really way different from the rest, and of course in a very bad way. So I took very keen interest in his case because that was a little bit out of the ordinary, and I decided, instead of sounding very harassing and punishing a student for something that I was not even able to understand, I sought to investigate what was the problem. And so the boy opened up to me and he told me that he was actually suffering from temporary amnesia. And in fact, his parents were arranging for him to be flown out of the country so that he would get better medical attendance. And so this temporary amnesia affects him. So he has memory lapses. And most of the times he cannot remember the previous event. So that goes without saying that even in the exam, he is not able to recall concepts that have been taught in class. Like, he was giving me an example that previous weekend, his friends told him that they had gone to the entertainment room and they had watched a good movie, and he could not remember any of that. And so since then, I have been treating the boy with a lot of care, because I understand that besides the poor performance, there's actually more than meets the eye. And so, of course, he's in the process of receiving medical attention, and I made sure that the administration was also aware of that, so that he is not bullied or harassed in other places in school, or where else he would be required to discharge his duties. And so that has really helped him to even settle down and feel less pressured, because he now feels comfortable to work at his own pace until his problem is resolved, which I thought was actually a very, very interesting case. So I can see there are people who have raised their hands. Let me pick Jen. Maina, you can share your experience. Jen Maina, can you hear me? Okay, in that case, then we can have Nancy Wagatwe. Please share your experience with us, how you have. Yeah.
Hello, you hear me?
Yes, I can. Please proceed.
Okay. Some of the mental issues in my area is like sodomy. I've come across sodomy in the course of this term, and also among the teachers, there are hard economic times, such that you may find teachers just rude or uncooperative. Some, not all, simply because of the hard economic times. Yani, the level of anger has gone up. Thank you.
Thank you so much. Thank you. I think I agree with you where you say that the harsh economic times are provoking all of us to anger and feeling so much pressured. So yeah, that to some extent is actually influencing even our mental stability at work. Thank you for that contribution. We can have Jen Maina, if you can hear me. Jen, are you able to hear me? Okay, then we can have Ryle. Ryle, can you hear me? Okay, fine. Then we can have Lefasi Ondoro. If you can hear me, please share your experience with us.
Okay, I can hear you very well.
Thank you. Proceed.
Okay, I can share my another health experience. There was a child in grade 1. This child could not walk properly most of the times. And when this boy I checked on the boy and found out that he had some swollen testes, both sides. They were very swollen, that even walk properly. So I inquired, I went to look for the sister and asked the sister, what is the problem? He told me he'd been taken to some hospitals, some herbalists, but the problem still occurred. So I went ahead, contacted the parent came, we organized, and so far the boy is due for an operation, and I hope it will go well and will come back to school. Another encounter in my school also, we have the rate of HIV, whereby most pupils are affected. So we've come up with guidance and counseling, which we do on Thursdays. We talk to them because we find it is a remote area. You find most of them, they come with drugs. They are not eating. There's no food there. You find sometimes we have even to offer porridge for them in school. The porridge meant for the ECDs, so that maybe we give them so that they can take drugs. That is the health experience we have in my school. Thank you.
Thank
Hello?
you. Thank you. Thank you so much for sharing your experience with us. I think I am very impressed with your story, because besides just you highlighting the situations that you have had to go through that are health related, you also doing your best to provide solutions to those problems. And that is the kind of environment you want to create for our students. Thank you so much. Lefasi, let's see. Nancy,
Thank
you still
you.
have something? Yeah, thank you so much. Nancy? you have something to share again? I can see your hand is up. The people whose hands are up, Ryle, there's Jen, there's Nancy, or I think you've just not lowered your hands. Okay, anyone else who has something to share with us concerning students and health-related issues and how they have been able to handle that in their school setup? Anyone? General? I think, oh, he or she lowered their hand again. Yeah, anyone else who has something? Yes, I can hear you. Please proceed.
You can hear me?
Yes, please proceed.
Yes, thank you. I just wanted to share another case that I handled in my school. There is a boy who had previously who was affected by TB. And then this one affected his spinal cord. And so he really had a big problem. So I talked with the parents. The parents said that they don't even. So this boy was even walking on crutches, but finally I referred him to hospital. And when he went, he was advised that he needs to go for some surgery. Then later on, I followed up the case. He went, he was booked to go to Moi Teaching and Referral in Eldoret, but he could not go because there was nobody to take him. Then I followed it up with the uncle who was in charge of him. Then finally he took him there. He was attended to, but he was not operated on. Then he came back, and but he was still really in pain. So I continued talking with him. Then finally, we found a way, and he went for that medication. He went and he received that operation. So he's still in hospital, but doing very well. And we hope that he shall come back safe. So this is a case that you see, it was first it was TB, which led to that spinal problem, which finally has led to him being operated on. So that is a health challenge that really affected this boy. Thank you very much.
Yeah, people come back to the plenary. Thank you so much for sharing your experiences. It has been fascinating to listen to your stories and really to learn on how you are dealing with the different issues here and there. I believe you all enjoyed the breakout rooms. I believe you've all learned something because the engagements were good, and all the rooms as I walked around were okay. I would not want us to maybe ask teams to share at the plenary because of time, but rather I'd like to conclude by maybe highlighting a few things that I think are important on matters health literacy, especially when addressing children, and more so the children that we have in our learning institutions who are adolescents. Health literacy for them is fundamental for sustainable development. It's fundamental for societal growth and health development over their life course. Now, health literacy is a determinant of health and a significant driver in sustaining health equity and a key empowerment strategy. So when we are okay on matters health literacy, especially when dealing with our learners, then we can be comfortable to say then our children have got a future. Now, health literacy will enable our children and adolescents, so to say, to access and navigate health information environments, be very free to go and look for that information, to understand health messages, to think critically about health claims and make informed decisions about their health, acquire health knowledge and use it in new situations. This can also help them communicate about health topics and concerns. When there is a topic that is touching on matters health, they become free to talk about it, especially right now. Sorry to mention that our young people are really going through a lot of mental health issues. Because one, there is the struggle on matters relationship, there is the struggle on matters academic. Some of them are struggling because they don't have money, pocket money, because their parents don't give them enough money, and so on and so forth. They can also use health information to promote their own health. They promote health of other people, the people that surround them, and also environmental health. This can also help them develop healthy behaviors and attitudes so that they start doing things right. Health literacy can also help our learners engage in healthy activities to avoid unnecessary health risks, become aware of their own thinking and behaving, also identify and assess bodily signs like symptoms. Like in one room, there was this discussion where a boy was having a challenge with his private parts, could not walk, but when he's taken to hospital or the herbalists, they find nothing, So the boy is able to tell that I am not okay. So there was need for further and further investigation. And then be a self-directed and lifelong learner. Because by getting a tip of some information about matters health, somebody can now go online and continue learning more about matters health. They can also develop a sense of citizenship, which is very, very important, and be capable of pursuing equity goals, and also address social, cultural, political, commercial determinants of health. Remember, health literacy, as we've said, it's not only about individual competencies and behaviors, but includes a holistic approach which incorporates the environment and thereby helping our children to achieve health and social goals. We've also talked about the organizational health matters, where everybody else is targeted, not just the learners, and not just the workers. So health literacy, as we have seen, is really very, very, very essential and important to all of us. So at that point, allow me to finish up. We are now moving to group processing. Let me finish up by sharing my screen. Okay, we've had a lot of time in our groups. I actually gave you about 35 minutes. The first discussion, you took around 15. The second discussion, you took around 20. Now think of one thing you each did well that contributed to the group success. Think of one thing that you each did well that contributed to the group success. And let us share at the plenary. I would like some of us to voice and the rest of us to use the chat box so that you tell us one thing you have contributed to the success of today's lesson. Sawa sawa? Yeah, we have the big group, the plenary. We also have the breakout rooms. Now, what did you do that contributed to the success of our lesson today? Faustin Maka, you will pronounce your name. Unmute yourself. Makalanya.
Yes, I'm called Faustin.
Yes. Yes.
This evening.
Yes.
One thing that we did well in our group, when we got into the group, we quickly chose the secretary. We also chose the chairperson to lead us. And then I was able to just get two very good gentlemen who contributed very, very fast. That was Nicholas and Keep Somebody. They really contributed so well. And I thank them so much. Thank you, Daktari.
Wow. I wish we had time so that you tell us what exactly you talked. But every group, the last discussion that you had was very powerful and I loved it. That was really good. Another person? Let me see. Yes. Let's have Elsie Nyangweso. Oh, okay, and then Lillian. Where is the boy child? I'm just having girls today.
Hello.
Yes, Lillian. Is it Elsie or Lillian?
It's Lillian.
Yes, Lillian, go ahead.
Yeah, thank you, Daktari.
Yes.
Whatever we made our group so successful in the discussion was putting the group leaders in place. They were guiding as well. There was good coordination amongst the members and everybody was able, quite a number, were able to participate within the given time. And all was well.
Wow. And what was your role, Lillian?
I was a participant within the group.
Wow, thank you very much.
Yes.
Yeah. Okay. Wycliffe Obare, then we go to Elsie, then we finish with Peter. I've given all of you rights. Yes?
Good afternoon.
Good afternoon, Wycliffe.
I've tried to be a secretary and I've positively, actively contributed through communication on this plenary.
Wow.
Thank you.
Thank you. Thank you. Elsie?
Yes. What I liked most about my group was that people had the online etiquette. People were able to mute their microphones and only speak when asked to do so. People were very organized. And I think this learning process is helping us to acquire other digital skills that will be able to make us better people. Thank you.
Wow. Peter?
Oh, yes. I was in room 4. I was chosen as the chair. But because time had really run, we were not able to get the secretary. So I doubled up as a secretary again. We discussed, quite a number of people discussed within time, and others applauded at the end of it all. Thank you.
Wow. Thank you, Leah.
Hello.
Yes, Leah.
Happy. The first groupings, I was in group 2. And I was the secretary of the group. And in today's lesson, I was the first presenter, and I'm very happy.
Oh, thank you, George.
I was able to coordinate group 12, bring everybody on board and to explain what our task was. And that made everybody very conscious and aware of what was expected of us in group 12 as a group.
Wow. Wow. Benson? Benson?
Yeah, thank you. I was we are in room 7 during the last discussion. And I'm very happy because we are very active. There's a teacher there called Jamal, if I'm not wrong, and plus the co-host Mugambi. So I like that every member was very active. We coordinated very well, and I also presented in the plenary session. So yeah, I have enjoyed today's session. Thank you.
Awesome. Rachel, Sister Rachel.
Yes, thank you so much.
I think I have had a good time. I was a chair in one of the groups, and then I got a chance to read a case study. I've been answering the questions in the chat box. I've been applauding others. And I've been an active listener as you did to your wonderful presentation. Thank you.
Oh, thank you very much. Captain?
Yes, thank you. I think what I learned a lot, I've learned a lot. I was patient, everyone was calm. But the first time in the preliminaries, there was a challenge because Jasmine was doing it alone. I tried to assist her, so I can applaud her.
Oh, that is good. Wow, thank you very much. And remember, in the learning process, I like telling my participants, let us embrace what we call collaboration more than competition. For us to learn, let us collaborate more. Collaboration simply means collaborate more and compete less, yeah? Be there to collaborate and learn from one another and reduce the spirit of competition, yeah? It is not about who is the best, who can do this. It is about what can we learn from one another? What can I share? What do I know? Because sharing indeed is inspiring. So it is time for us now to think about our reflections. But before we can get to the reflections, there are quite a number of chats that have been shared at the chat box. I believe each one of us has shared what they did, being a good listener, coordinating the group, contributing by taking, being the secretary, giving experiences, active participation. Wow, you shared opinions, participated actively in the breakout rooms, sharing, reading, answering questions, and so on and so forth. Thank you very much. Now, can we all go to the reactions and appreciate ourselves? Let us clap for Let us go to reactions. Appreciate everybody who has made this day a success. I want to appreciate all of you for the wonderful discussions that we've had at the plenary, even in your breakout rooms. That was wonderful. Thank you very much, everyone. Thank you for the good work and really keep it up. I hope we'll continue with that spirit tomorrow. Now it is time to write our reflections. Please, after this, because there is a lot that we've learned, go to the LMS, the virtual campus, indicate what you have learned, what you need to learn more about, what you like about the day, and suggestions how we can improve, and suggestions on how we can improve. That is very, very important. And so we've come to the end of our lesson today. Thank you for being there 100%. It was my pleasure facilitating learning to the end. Mr. Ngatia was supposed to join me, but they got a challenge. So he'll be talking to you probably tomorrow. And then later you will be doing this. You can develop a health policy for your school. Remember, we said it's important for each one of our institutions to have an institutional policy. Then you can share what you have discussed. This is just an extended learning activity to help you practice on the things that we have learned. Maybe what you can do, just take a screenshot of this slide so that you can have the 6 points to refer to. Then you can develop your institutional health policy. It will be my pleasure to learn that out of this lesson, you enabled, or rather you helped your school to develop a health policy. Thank you, and God bless you. So we've come to the end of our session today. Maybe I will hand over the platform to our leader, Madam Eunice Mugambi. Madam Mugambi, are you in the room? Over to you. Madam Eunice Mugambi, unmute yourself. We cannot hear you. Madam Eunice Mugambi?
Yeah, sorry, the host was not allowing me to unmute myself, but now I'm okay. Thank you, Dr. Christine. I must say it was indeed an engaging facilitation of learning. I'm sorry, on and off, I was out. I was equally coordinating another session. There was a challenge which I'll communicate to you later. However, I thank God that the few moments that I was able to log in, I was finding a very vibrant class, and you have set the momentum, and I will share the same with our two other facilitators, that is Madam Rebecca and Madam Gatia. In fact, today we have had a very healthy, engaging discussion. And I think sometimes even working out our activities within the plenary room sometimes works well, because we are able to share experiences and even learn from one another. I thank you very much for engaging my participants. As a leader, I remain humbled. Participants, we are very, very much appreciative for your positive responses. You have participated very well in today's session, and I hope even for the remaining 3 days, we will do the same. May I now invite someone to do our closing prayer? You have some parting shot, Daktari, before we play?
No, there were some people who had raised up their hands early. Ngoiri, Mary, maybe they have a question or something.
Okay, maybe we can give them a chance, but I know most of them were asking about the registration link, of which I have shared, and quite a number of participants are still posting it there. And because it is 2 minutes to our closure time, maybe we can do a prayer for any person with a question can remain behind, and we can attend to them.
Thank you. Thank you, participants. Thank you for the feedback. I've been reading your responses. Really, may God bless you. Thank you. Thank you for appreciating what we have done today.
We can have a volunteer to do our closure prayer. I can see quite a number of them.
I can pray.
Okay, karibu.
Asante. Let us pray. In the name of the Father, the Son, and the Holy Spirit. Amen. Loving God, we thank you for this opportunity, and we thank you for the gift of one another, Lord. As we depart from this forum, bless our facilitators, bless all the participants, that all we do may be for your honor and glory, for our learners to benefit and have a better future. Bless us, O Lord, with the good health, mind, and body as we continue doing this, your wonderful work. I pray this through Christ our Lord. Amen. In the name of the Father, the Son, and the Holy Spirit. Amen.
Amen.
Good night, all. Thank you.
Good night. Good night and God bless.
Thank you, Akinyi Mary Bernard. Good night, participants. Let's meet tomorrow exactly at 5:30 p.m. Thank you.
Welcome.